Welcome to Advancing Health. The recent outbreak of the dangerous Hantavirus infection on a cruise ship sent countries around the world, including the U.S., scrambling to bring their citizens home for quarantine and treatment. We learn more about America's ongoing response to the threat in today's podcast.
Hi, everyone. This is Dr. Chris DiRienzo. Thank you so much for joining us again on the Advancing Health podcast. I am incredibly excited to welcome to the podcast this week Dr. Angela Hewlett. She is a professor of infectious diseases at the University of Nebraska's Medical Center, also called UNMC, and the medical director of Nebraska's Biocontainment Unit, which is not a thing that I imagine many of you know exists, and something that we're going to talk a little bit about over the course of our conversation today. Dr. Hewlett, thank you so much. Welcome to the podcast.
Oh, thanks for having me.
Before we jump in, if you would, tell us just a little bit about yourself and what brings you to the conversation today.
Well, I'm an infectious diseases specialist by training, and so I am originally hail from Houston, Texas, and did all of my training at University of Texas Medical Branch in Galveston, Texas, including an infectious diseases fellowship. And then I transitioned to Nebraska for my first so-called real job in 2009, and part of that package actually did involve the need for an associate medical director of the Nebraska Biocontainment Unit, which at the time I didn't really know existed, and like many people, but I was absolutely just floored by this facility when I visited this university, and it really was part of the reason that I landed here in Nebraska in 2009. So I became associate director of the Nebraska Biocontainment Unit at that time, under the direction of Dr. Phil Smith, who was my mentor and the founder of the Nebraska Biocontainment Unit. And he was the director of the unit until 2016 when he retired. And then I've been the director of the Biocontainment Unit since 2016.
Wow, we've seen a lot in those 10 years, but perhaps let's start the conversation with a little bit more about the role that UNMC plays in the nation's critical medical infrastructure, because truth be told, before I joined AHA 3.5 years ago, I really had no concept of just how deeply integrated you are into how America manages emerging infectious diseases. So really, what is the Biocontainment Unit and what kind of work do you all do?
Well, here in Nebraska, we actually have two facilities that are designed for the care and monitoring of both patients and individuals who have either exposures to high consequence infectious diseases or are infected with high consequence infectious diseases. And we're part of a network called the National Emerging Special Pathogens Training and Education Center, or NETEC. And this network was actually built after the 2014 Ebola experience. And there are 13 regional emerging special pathogen treatment centers, or the RESPECTs, in the United States currently, as well as multiple level 2 facilities, which are also designed for the care of high consequence pathogens. So those 13 facilities serve as the leads within their regions within the United States. And here at UNMC Nebraska Medicine, we are one of the originators, the founders of NETEC, so one of the 3 facilities alongside Emory and Bellevue, New York City as well. And so we brought this network up actually to enhance preparedness throughout the United States. But our facilities have actually, the Nebraska Biocontainment Unit has actually been here since 2005. So this unit was dedicated in 2005. And our first official activation was actually in 2014 when we did care for 3 patients infected with Ebola virus disease. But we do have 2 facilities here at UNMC that are designed strictly for this purpose. And the first facility is a national quarantine unit, which is actually the only quarantine unit of its kind in the United States. And it's a federally funded facility. It has 20 beds in the unit, and it's designed to monitor individuals that have exposures to high consequence infectious diseases. So this is not a patient care facility per se. It's more designed like a hotel. And because we know that our guests can potentially be with us for a prolonged period of time. And so we have things in the rooms like, a refrigerator and a TV with streaming capabilities and exercise equipment in every room, just to try to make this kind of difficult quarantine experience as comfortable as we can be. Our guests have access to, in-person and virtual behavioral health support, which is, I think, critically important in a mission like this, where we have individuals who do stay with us for a prolonged period of time. We host a daily town hall meeting where our guests can communicate with our team and with each other, just to kind of interact and discuss the different scenarios and things like everything from testing plan to food to, really anything else that they would like to discuss throughout the day. Although that facility is designed sort of like a hotel, it also does have some interesting capabilities in that it is all negative pressure. We are monitoring these individuals, which, should they become ill, we have negative pressure throughout our unit, as well as an autoclave that we could potentially use for waste disposal if necessary. So there are some more unusual aspects. So it's not your typical hotel, but it was really designed to monitor individuals with those types of exposures.
That is the understatement of the century, not your typical hotel. Well, before we go one level deeper, you've used the term high consequence pathogen or high consequence infectious disease a couple of times. For a non-ID doc, for our general listener population, what is a high consequence pathogen, and what are the kinds of potential infectious diseases that folks would be exposed to where this would be a unit that we might send them to for the kind of monitoring you're describing?
So a high consequence infectious disease, and I will say there's been a lot of work on this because the terminology has changed quite a bit over the years. You may have heard highly infectious disease or highly hazardous communicable disease or a special pathogen. Those terms are all essentially interchangeable to really mean the same thing, and that is a disease for which there is a chance for transmissibility between humans, a disease that has potentially a high mortality rate, or for which there are minimal or none as far as therapeutic agents or vaccines. And so typical diseases that fall in that category of high consequence infectious diseases include things like viral hemorrhagic fever, so things like Ebola virus disease, Lassa fever, Marburg, smallpox is in that category. Certain types of mpox potentially, depending on the facility, could be classified as that. So there are multiple types of diseases that could fall in that category. The most recent that we've been dealing with is the Andes virus, which is a hantavirus, but it's the only hantavirus known to be transmissible person to person and has all of the things that I mentioned as far as limited therapeutic options and no vaccine. So we would classify that as a high consequence infectious disease as well.
Well, let's spend a minute then on the subtype of the hantavirus, which the Andes virus, it sounds like what it is called by those in the know. We know that hit the news in a substantial way earlier this year. Help us understand the role that y'all played in Nebraska in the nation's response, and where are we in the arc of that response right now?
Well, so the initial cases of Andes virus were actually reported off of the MV Hondius cruise ship that was an expedition ship that was started in Argentina and made its way across the Atlantic to some very remote areas around the world, mostly territories, actually. So again, an expedition ship with a lot of very active outdoor exposures and other things that occurred. Well, unfortunately, an individual on that ship became ill very quickly after boarding the ship in early April and succumbed to his illness on board. Subsequently, his wife became ill, as did another passenger. And so then there started to be some concern for, is this a disease that's transmissible human to human? What could this possibly be? And as more people got sick, eventually those individuals, when they were transferred off of the ship for medical care, eventually the diagnosis was made of a hantavirus, and then eventually the Andes strain of hantavirus. And so that occurred in all throughout April, essentially. In early May, many of these people were still on the ship, and they had individuals who had become ill, who had been transported off of the ship, but also a fair number of people who had had various exposures during the cruise. And if you think about a cruise ship, there are potentials for lots of in-person contact with each other, lots of close contact potentially. And this was a special voyage. It wasn't your typical kind of large cruise line. This was very much an expedition where they had a lot of close contact with each other. It was a small ship, but still a lot of prolonged contact with other people on the boat. And so because of that introduced the possibility of transmission of Andes hantavirus, which is what was occurring on the ship. So when the ship eventually docked, all of the individuals on the ship had a potential for having exposure just due to the number of cases of hantavirus that individuals that became ill on the ship, including the ship's physician, actually. And so after that happened, then each individual country flew a plane essentially to the area, and actually, which was the Canary Islands at the time, and actually then took their citizens back to their home country. So this happened all over the world. This was a cruise that had many countries involved from all over the world. And those countries actually came back and essentially, picked up their exposed individuals and took them back home for quarantine. And so here in the United States, because we have the National Quarantine Unit here on our campus, that was our job, is to monitor those individuals. And, should they become ill, then we have the possibility of transferring them into the Nebraska Biocontainment Unit, which is our patient care unit. We originally accepted 16 individuals that had exposure to Andes hantavirus on the cruise ship. Later, we received an additional 2 individuals, and so we had a total of 18 when we started this on May the 11th. And so we're still currently monitoring 8 individuals. Since that time, some of our individuals have actually been transferred home for home quarantine. So they're still under quarantine for 42 days total, which is the maximum incubation period of Andes hantavirus. The average incubation period is around 18 days, and we have definitely surpassed that. And so we are definitely past the average incubation period, but not completely out of the woods with our individuals yet. We're very fortunate to have PCR testing capability here on campus, which is a very unusual entity.
Especially for such a rare virus. In order to be able to test for it, you truly have to be in like the top leading center in the country, which you all are. And it really sounds like the connection there between the quarantine unit and the biocontainment unit make it a potentially seamless experience. So it sounds like, I think I heard you say we're not out of the woods yet, but in terms of timing here, we're on hopefully the back end of what could have been, much more significant kinds of exposures.
Yeah, absolutely. And I think just to highlight the reason that the National Quarantine Unit is here on our campus is because of the Nebraska Biocontainment Unit, which is our patient care facility. So we're an all ages, all hazards unit. We can provide a full spectrum of clinical care in the Nebraska Biocontainment Unit, everything from typical supportive care to critical care modalities like mechanical ventilation, dialysis, ECMO, really the full spectrum of clinical care. And that unit is also negative pressure throughout. With the gradient, it has HEPA filtration of all of our exhausted air. We have dual autoclaves for waste management. We have an in-house laboratory, as well as laboratorians who train with us on our team and come in and process specimens for us right inside the unit. We have a large trained team of healthcare workers that includes physicians from multiple different specialties. And I mentioned all ages unit. We have pediatricians, we have pediatric infectious diseases specialists, peds critical care docs, neonatologists. We have a cadre of surgeons actually on our team as well. We have a CT surgeon who's actually part of our team, as well as obstetricians. There's a chance that we could need to care for a pregnant individual and potentially a neonate as well. So all of our team members, including the physician groups, as well as the nursing team, which comprises a variety of different specialties of nurses. We have respiratory therapists on our team. We're an all-volunteer team, actually, so none of our healthcare workers are compelled to do this type of work. We have a lot of team maintenance activities. We have ongoing training that we're required to participate in, as well as drills and exercises and team building events and things like that really enhance our team. So, again, these 2 facilities are an unusual entity, and the fact that they're co-located on our campus makes us sort of the spot to be, if you will, for individuals who require quarantine. Also, keeping in mind that, that's the reason that these facilities are here, is so that should we need to care for someone with an infection, we're able to do that readily.
Well, they truly sound like a one-of-the-kind duo. And you mentioned back in the 2014-15 Ebola virus disease response, the unit was active. I got to be honest, in 2026, the recurrence of Ebola virus in the conversation globally was not on my dance card, but we know that there's one of the most significant Ebola virus disease outbreaks going on in history right now. What are you all seeing? Again, we know you are as plugged in as any unit could possibly be in the global conversation. Where are you seeing that outbreak trending at the moment? And what, if anything, should hospitals be doing in preparedness?
I'm really concerned about what's going on in the Democratic Republic of the Congo and Uganda. There have been a large number of cases and deaths associated with this outbreak, which actually is reminiscent of the earlier days of the 2014 outbreak, which occurred in a different part of Africa, so in West Africa. But still, just the large number of cases and the ongoing increase in case counts that we're seeing on a daily basis The 2014 outbreak resulted in around 28,000 cases and about 11,000 deaths. And I'm really hopeful that we won't see that number of cases with this outbreak, but I'm very nervous about that, just given the kind of volatile situation that's occurring, particularly in this area of the Democratic Republic of the Congo, which has a history of outbreaks in the past. So this is not the first time that they have seen Ebola virus disease, but they also have a very mobile population in that area, limited access to healthcare, which subsequently results in limited access to testing, as well as a history of conflict in the area, which really makes this scenario very difficult. And so I'm definitely concerned about what is going on overseas. As far as preparedness locally, we should all be aware of what's going on throughout the world because these outbreaks are occurring regularly, and they're also something that we need to take note of because there could always be imported cases of any infectious disease with travelers who either are from the United States and go travel abroad and return, or travelers from other countries who are coming to the United States. And a great example that is occurring right now is the World Cup, just in the fact that there are a lot of fans who are coming to the United States and traveling to other parts of the world for these games. And so facility preparedness is incredibly important. And I think infectious diseases, we use a mantra that we call identify, isolate, and inform. Facilities, regardless of the size of your facility, it could be, the smallest kind of critical access hospital or a clinic or the emergency department or a large academic center. People can present to any of these settings. And so even the smallest hospital needs to be ready to at least identify, isolate, and then inform appropriate authorities should there be concern for high consequence infectious diseases. And the way to do that is to make sure that you have protocols in place that can identify symptoms that are appropriate and concerning, as well as a history of travel, which, we actually have frontline in our facility. We utilize our electronic medical record. And we ask patients a set of questions on intake, whether they're coming into our emergency department or to any clinic setting. And then the answers to those questions sometimes lead to the isolation of that individual or further questioning or, the activation of some of our protocols. So I would just emphasize that it's really important that every facility is prepared, and it doesn't matter the size of your facility because people definitely will present. And so we need to be ready for that.
Dr. Hewlett, that is the perfect note to end today's conversation on. You hit the nail on the head. I've been to every conceivable kind of hospital in America, and none of them, except UNMC, have your unique combination of the National Quarantine Unit and a Biocontainment Unit. But every hospital can follow those kinds of steps in every clinic and every outpatient center. Those steps really are sort of the foundational baseline of us being prepared. And that's what today's conversation has been all about. Thank you so much for joining the podcast. This has been a fascinating conversation. And I certainly wish you all the best as the summer goes on.
Thank you so much. I appreciate you having me.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.